Hello, and welcome to Introduction to Psychology. This presentation continues our coverage of psychological disorders. You will recall that one way to classify psychological disorders is to use the DSM. The DSM has chapters devoted to various disorders. We have already looked at depression and personality disorder. We will now look at a variety of other disorders, starting with anxiety disorders. Anxiety disorders are psychological disorders characterized by excessive fear and anxiety. Fear is a reaction to present danger, while anxiety is worry about future events. One type of anxiety disorder is specific phobia. Specific phobia is a persistent and irrational fear of an object, activity, or situation. That is, it is when people are unduly scared by something, when their fear is out of proportion to any actual risk. For example, some people are excessively scared of flying, some people are excessively scared of snakes, and some people are excessively scared of needles. Some people are even scared of buttons. Sometimes phobias are caused by innate fear. We are genetically predisposed to fear ancestral threats such as heights, snakes, and spiders. However, many snakes and spiders are harmless, hence the fear of them is somewhat irrational. Sometimes phobias are caused by associative learning. That is, phobias arrive when we form a mental link between the phobic thing and a bad outcome. For example, if someone experienced a turbulent flight, then they might learn to associate flying with danger. Or if someone experienced a clumsy injection, then they might learn to associate needles with pain. Sometimes phobias are caused by social learning, that is, learning from others. For example, one might be told that something is more dangerous than it actually is, or one might see someone else being fearful of something, so assume that it must be dangerous. Another anxiety disorder is generalized anxiety disorder. GAD manifests as a persistent worry about a whole range of events or activities. That is, sufferers fret that things in general will turn out badly. For example, they worry they will lose their jobs, they worry that their car will break down, they worry that their partners will leave them, and they worry that they might get injured. This constant worry leads to restlessness, irritability, fatigue, and difficulty sleeping. Generalized anxiety disorder has many causes. One cause is negative life experience. That is, if a person has had many things go wrong in their life, then they learn that the world is dangerous, difficult, and traumatic. Believing that the world is perilous causes sufferers to jump to the worst possible conclusions about events. Another anxiety disorder is panic disorder. Panic disorder manifests as a recurrent, unexpected panic attacks and fear of future panic attacks. A panic attack is an abrupt surge of fear or discomfort that reaches a peak within minutes. Some panic attacks can be expected. For example, going into a scary situation is likely to make a person's heartbeat quicker, their breathing to become shallow, and for them to feel hot and afraid. For panic disorder to be diagnosed, the person must experience unexpected panic attacks. That is, panic attacks that come out of the blue without any apparent trigger. For example, some people experience nocturnal panic attacks that start during sleep. Panic disorder can lead to agoraphobia. Agoraphobia is the fear of situations from which escape might be difficult, or situations in which help won't be available. Agoraphobia arises because sufferers worry that they might have panic attacks in such situations. There are many causes of panic disorder. One cause is biological vulnerability. Some people have highly sensitive amygdala, thus they have emergency alarm reactions to things that most people do not. The next category of psychological disorder that this presentation will look at is the trauma-related category. The most well-known trauma-related disorder is post-traumatic stress disorder, or PTSD. PTSD is a disorder characterized by recurrent distressing memories of a traumatic event, avoidance of things associated with that event, negative mood, and changes in arousal. It is caused by exposure to a traumatic event such as combat, rape, assault, or natural disaster. Distressing memories of the event might include nightmares and flashbacks. Avoidance of things associated with that event might include keeping away from the site where the event occurred. Negative mood might include feelings of shame, anger, or detachment. And changes in arousal might include an excessive startle response, that is, extreme jumpiness. The more naturally anxious a person is, the more likely they are to suffer PTSD. The less social support a person has, the more likely they are to suffer PTSD. And the more unpredictable the traumatic event, the more likely a person is to suffer PTSD. Treatment for the condition focuses on helping sufferers regain control over their lives. For example, avoidance can be treated with exposure therapy. This involves gradually and safely going back to places that you fear until the fear dissipates. For example, you might go closer and closer to the site of an attack while accompanied by someone else, or even visit the sites in a virtual reality setting. Negative mood can be treated with cognitive therapy. This involves recognizing and changing unhelpful patterns of thought. For example, recognizing that you are being harsh on yourself. Eye movement desensitization and reprocessing, EMDR, involves moving your eyes from side to side while briefly focusing on a traumatic memory. The process helps reduce the emotional intensity of the memory, making it less distressing for patients to recall. As a result, it enables patients to process memories that were previously too upsetting to think about clearly. The next category of psychological disorder that the presentation will look at is the obsessive-compulsive category. OCD is a disorder characterized by the presence of recurrent troubling thoughts, which are known as obsessions, and/or irresistible repetitive behaviors aimed at reducing anxiety, which are known as compulsions. OCD can be explained in the following way. Everyone has strange thoughts now and again. For example, about engaging in unacceptable behavior, harming others, contamination, or having forgotten something. However, some people have brain circuitry and serotonin systems that make it hard for them to inhibit these thoughts. In addition, they believe that having a bad thought increases the chances of that thing happening. So they worry about these strange thoughts more than others. The idea that thinking a thought makes it more likely to happen is known as ironic processing. I beg your pardon, is known as thought-action fusion. In an attempt to reduce worry, sufferers of OCD try not to think about their troubling thoughts. but this just makes it more likely that they think about them. The phenomenon whereby trying not to think about something makes it more likely that a person will think about it is known as ironic processing. In an attempt to reduce worry, people with OCD often use rituals such as checking, washing, and ordering to try and calm themselves down. As these rituals often work, they do have a rewarding calming effect, then sufferers of OCD do them more and more. Another category of psychological disorder are bipolar disorders. A widely known bipolar disorder is bipolar I disorder. Bipolar I disorder is a disorder characterized by isolated manic episodes or manic episodes that alternate with periods of depression. The symptoms of a manic episode are elevated mood, sufferers feel very positive and upbeat, decreased need for sleep, increased self-esteem, sufferers feel very good about themselves and their capabilities, flights of ideas, sufferers often come up with many wild plans and schemes, delusions, and hallucinations. Manic episodes are severely debilitating and often require hospitalization, as, when manic, people tend to engage in risky behaviors such as gambling, drinking, drug taking, and reckless driving. Bipolar I disorder is thought to be caused by neurotransmitter imbalance, an overactive dopamine system, which can be triggered by stress or harsh living conditions. About 3% of the US population suffers from bipolar I disorder. 25% of these are rapid cycling. They experience 4 or more manic episodes a year, and 75% are non-rapid cycling. They experience less than 4 manic episodes a year. The typical cycle is 2 episodes per year. That is 2 13-week manic episodes that may or may not alternate with 2 13-week depressive episodes. The last category of psychological disorder that we will look at is the schizophrenic spectrum. The most widely known disorder in this category is schizophrenia. Schizophrenia is a psychotic disorder in which personal, social, and occupational functioning deteriorates as a result of disturbances to thought, emotion, and perception. That is, the sufferer's symptoms prevent them from holding down jobs, forming relationships, and looking after themselves properly. Symptoms of schizophrenia can include hallucination, which is seeing or hearing things that don't exist, for example, hearing voices. Delusion, which is believing things that aren't true, for example, believing that one's thoughts are being stolen by the government. Disorganized speech, which is talking in an unusual manner, for example, repeating phrases, talking in rhyme, flitting from topic to topic, forming sentences that make no sense, muttering or shouting. Disorganized behavior, which is acting in an unusual manner, for example, dressing strangely or not washing. And negative symptoms, which are symptoms that show a lack of something, for example, showing a lack of emotion, a lack of energy, a lack of movement, or a lack of speech. There are several possible causes of schizophrenia. Firstly, some people are genetically predisposed to the condition. Secondly, people with schizophrenia tend to have overactive dopamine systems. And thirdly, people with schizophrenia tend to have enlarged ventricles. Ventricles are brain cavities that contain cerebrospinal fluid. Cerebrospinal fluid cushions the brain and provides it with hormones and nutrition. The brain has 4 ventricles. The ventricles of schizophrenics tend to be enlarged. Ventricle size itself may not be the problem. Ventricle enlargement might simply indicate that adjacent parts of the brain have atrophied or have not fully developed, and it might be this that causes the condition.